Hello, welcome to Nursing with Professor B. My name is Bridget. I have a master's degree in nursing education. I'm also a family nurse practitioner. Okay, if you've ever wondered if you have ADHD, then in this video, I will be discussing the diagnostic criteria. Before we get started, make sure you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. Let's go. In today's video, I will be going over signs you may have ADHD. By the way, the DSM-V, which is the Diagnostic Statistics Manual, did away with the diagnosis of ADD. It's all under ADHD. And before all this, though, this is the disclaimer. Please do not self-diagnose yourself. Information is purely for educational purposes. If you think you may have ADHD and it's interfering with your life to the point where you think you need to do something about it, then please see a psychiatrist. They are the ones that can prescribe medication for you. Or you could always see a psychologist or therapist for tips in how to manage ADHD without medication. Okay, so ADHD has primarily been divided into the inattention category and the hyperactivity impulsivity category. So instead of being diagnosed with ADD, attention deficit disorder, attention deficit hyperactivity disorder, but mostly inattention, so lacking the hyperactive side. So in order to be diagnosed with ADHD, if you are less than 17 years of age and you have 6 or more of the following symptoms, then technically you would be classified as having ADHD. If you are over 17 years of age and you have 5 or more of the following, then you would technically have ADHD. Now keep in mind, this is why you need to see a professional, because symptoms, it's not this straightforward. Symptoms need to be present in 2 or more environments. You can't just have ADHD at school but be fine at home. You need to have symptoms present, whether it's at work and school, or school and at home, etc., etc. There's also a category of combined presentation, but I won't be covering that today. So ADHD inattention type. Number 1, they fail to give close attention to details. That could be someone that overlooks or misses details. Work is inaccurate. They can make careless mistakes in schoolwork, at work, or during other activities. So for example, I once took a gifted test and I skipped one line. It was a bubble. This was way back in elementary school and they were testing me for gifted. So I skipped number 2 in the bubbles. So 3 through on was off by a number. So careless mistakes like that, you're in such a rush that so obviously I bombed that test because it was miskeyed and they wouldn't allow me to retake it and I couldn't go back and take it again. So ADHD does affect day-to-day life and it may affect grades. So the Diagnostic Statistic Manual, the DSM-V, is essentially the Bible for psychiatrists. It's what they follow. It's how they diagnose. This is where I'm getting the information from. They do say, so the DSM-V does say that ADHD begins in childhood and that the requirement is that several symptoms be present before age 12 years. When I went to a psychiatrist, he did diagnose with me ADHD, even though I never had that diagnosis as a child. But again, I kind of just always slipped through the cracks. But my parents are also Latin and minorities tend to be underdiagnosed. My parents don't really believe in going to the doctor unless, I was dying. So, they did the routine well checks, but other than that, it's just push through it. You could do it. Stop slacking. It's just a lack of discipline. That's what they were telling me. That's not what I believe. You could always try, if you're struggling in school, and you feel like you're going to fail because you can't focus, you may need to go to a psychiatrist for additional help. So, and one thing to note is that Adderall is one of the most widely abused medications in college age adults. So make sure that you're using it because you really need it and not because you are abusing it. Never use Adderall illegally. Always have it prescribed by a psychiatrist. It is a controlled substance. So if you take it illegally, you're breaking the law. Okay, number 2, symptom of ADHD, difficulty sustaining attention in tasks. Oh, this is me all day, every day. So sometimes with ADHD, you can have hyper focus, but if it's something you're not really interested in, for example, I could edit videos and 3 hours go by and I don't really realize where the time went. But reading one page out of a nursing textbook was like, I would read the same line over and over and over. It just was not getting in here. So they have difficulty remaining focused during lectures. Me. So what I would always do is write notes, because if I'm not actively engaging all of my senses, then I'm going to tune out. So difficulty remaining focused during lectures, I would write notes, I would doodle, anything that makes me present. Conversations, sometimes someone will be talking to you and all of a sudden you're like, oh crap, I just checked out of this conversation. Lengthy reading. So again, in graduate school, it's like, oh, here you go, read 300 pages by Monday. And you're like, oh my gosh, I can barely get through this chapter. Often does not seem to listen when spoken to directly. So what this means is that sometimes your mind seems to be elsewhere, even in the absence of an obvious distraction. So the whole daydreaming a lot. Often does not follow through on instructions or tasks. So I can't tell you how many times I have started to take out clothes from the laundry after they've been washed. And I'm doing that, and then something will pop into my mind like, oh, I haven't done this. I go do that, and then I forget about the clothes in the wash, and then the clothes is there, or I wash them and then they just stay overnight, and I'm like, I have to rewash them. Or I'll start washing dishes and I leave midway through, and then I don't wash the dishes, and then so you don't follow through on tasks. Like you start and then you get distracted by something else, because with having ADHD, it's like having 1,000 thoughts pop into your mind all the time. Your brain is go, 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 go. You start tasks, but you quickly lose focus and you're easily sidetracked. What I did to overcome this as a nurse was to be extra organized. Like, thank God this has not affected my work ever. It's mostly my home life, home and school. A sheet out of all my patients when their meds were due, so that I was constantly checking it, so that I was not missing important things at work. And all right, difficulty organizing tasks and activities. So difficulty keeping materials and belongings in order, messy, disorganized work, often has poor time management and fails to meet deadlines. So thank God I can meet deadlines. That's the only one out of all of these that I don't struggle with. I struggle with time management. I always think I have more time to get somewhere. I'm chronically late. For work, what I do is I have to tell myself, if I start work at 8:30, I have to tell myself I need to get there at 8. So I in my brain, it's like my start time is at 8. So that even if I'm half an hour late, I'm still on time, because otherwise, like dates, a lot of times I felt really, and we don't do it to be rude or, I really like, what this author wrote. She has a PhD, Michelle Novotny. So I just wanted to write, like people with ADHD have, they stand up their friends. Oh my gosh, it was so bad. I forgot, because my work schedule is so, I don't work Monday through Friday. Like I'll work some Saturdays or Sunday. Like my schedule is all over the place. So a lot of times I forget what day of the week it is. So one day I had a date with someone. This was a while back before I was in a relationship. I had a date. I forgot what day of the week it is. We had a date set for Saturday and I was convinced it was Friday. So that day, the guy calls me. He's like, hey, where are you? And I was like, what do you mean? Our date is tomorrow. He's like, no, today is Saturday. So I felt so bad. Not on purpose. So you stand up your friends. They pick up the kids late from school. They leave others waiting as they scramble to finish last minute tasks or find misplaced wallets, cell phones, all the time. Am I misplacing stuff or forgetting things? So people with ADHD don't intend to be inconsiderate or disrespectful. It's not an attitude, but because of chronic tardiness, they're often perceived that way. So this is what I do with my thing. I start backwards. I start with my appointment, what time I need to get there. And even on top of that, I'll give myself an extra 30 minutes. And then like I work backwards to see what time I have to leave my house. And I over exaggerate everything. Okay, it takes me an hour to get to work. I have to be there at 8. So I have to leave at 7. So I have to wake up at like 5:30. I give myself exaggerated amounts of time, because even when like I'll just get distracted in the mornings, like doing a million things that I should not be doing. I should just be getting ready for work. So yeah, so that's definitely a sign of ADHD. Next one is avoids or is reluctant to engage in tasks that require sustained attention. So yeah, it's hard. It's hard to study if something that is like a boring topic or that you're not interested in or that's very dry. It's hard to keep your focus and attention. So if you have ADHD, you probably have checked out of this video by now already. But hey, for those that are still watching, good job. I'm proud of you. So what we mean by that is like schoolwork or homework. For older adolescents and adults, preparing reports, completing forms, or reviewing lengthy papers can be a challenge. They often lose necessary things. Oh my gosh, if this is not me, to this, I can't tell you how many times I've misplaced things, I've left things. One time at a clinic at my job that was about an hour away, I left an important notebook. So I've developed systems so I don't forget things. Like, so what I use for work, my work keys, I know I cannot forget that because I can't open the door to get in. So I leave that in my car, right? I have to take my car to work. So I leave my watch, my keys in my car already. And after I leave work, I always put them in the same spot because if not, I will lose them and I will be like a chicken with my head cut off. But even though I have systems in place for work, again, I'm always losing things. It's really frustrating. I've lost my credit card within the past 6 months at least 5 times. So I'm losing it like once a month. Every month I'm calling the credit card company like, hey, so I lost my credit card and they're sending me a new one. So, ADHD affects a lot of things in life. And then in regards to the mess, like it's really hard for us to stay organized. That was the battle. Like when I was younger, my mom was always, it was a constant fight between my mom and my dad. Like always, my sister is super organized. Like she's almost like obsessive compulsive with her organization skills. And I'm the opposite. So it was really hard for me as a child because like there was so much pressure. My parents are very like perfectionistic and they always wanted everything like in order. They're super organized and I'm like the black sheep. It was a struggle. Like it does not come easy for my room to be in order and everything where it should be. To this day, finally they just gave up because otherwise it would have just been a constant battle. To this day, my room will usually be a mess. It is what it is. And I know it's my ADHD because when I would take the Adderall, my room was pristine. All of a sudden I would get motivated to like organize and clean my room. And I'm not dirty. Like I clean, I sweep, I mop. It's just clutter. And like my desk always, everything I need is always visible. Because a lot of times with ADHD, it's like out of sight, out of mind. So a lot of things that I need, I like to have them visible and easily accessible. It just is the way my brain works. They're easily distracted by extraneous stimuli. Yes, yes, yes. All right. So if you're easily distracted, you have to wear earplugs. I love these. I love these earplugs. So for tests, I would always take earplugs because when you have ADHD, your brain does not filter sound. Like you can't, anything you hear, having ADHD is like, how could I describe it? When you're listening to a soundtrack, like the person that's singing, their voice is louder than the backup singers. Having ADHD is like hearing the backup singers and the main voice and the music all the same. So everything just kind of gets jumbled and you can't filter it. So it's really hard because when you're taking a test, you hear that person tapping their foot. You hear the rustling of papers and everything distracts you and it's so hard to get focused and you're trying to read the sentence but you hear this noise over here and you're just like, oh my gosh, I just need silence. So for me, I have to study with silence. In regards to often loses necessary things, you could lose your wallet, your keys, paperwork, eyeglasses, your cell phone, things like that. Forgetful in daily activities. You may forget to do chores. You may forget to do errands. So if you have a partner that has ADHD, please be patient with them. You may have told them to do something and then they didn't do it. And it's not because they don't want to do it, but they just forgot. It slipped their mind. They may not return calls. I do that all the time. I think a lot of us do things like that. Like someone will text you and you just forget to text back. You start to text and then you never do. Paying bills, keeping appointments, etc. Next, we're going to go to the second category of ADHD, which is hyperactivity and impulsivity. The thing that I want you to know is that we all have certain traits and we all have a number of these. It doesn't mean you have ADHD, right? Remember that the category, if you're over 17, is having 5 or more. And if it interferes with your daily life, if it doesn't interfere with your daily life to a point where you find it concerning, then try to do behavioral techniques or behavior modification techniques to make your life somewhat easier. So with the hyperactivity and impulsivity classification, they often fidget, tap, and squirm. They leave their seat in inappropriate situations. So for example, they could leave their place in the classroom, in the office, or other workplace, or in other situations. Children would be the ones that most likely would do this. Sometimes when I'm eating by myself, I'll want to like get up in the middle of eating to go do something when I should just finish my meal. Climbs or runs in inappropriate situations. Again, that's in adolescents or adults, it may be limited to feeling restless. So that restless feeling, like you want to leave, but you know it's not appropriate. So you kind of just have to stay there, even though like your body is telling you like, okay, I really want to go. Unable to play or engage in leisure activities. And again, because the mind is always go, 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 so they're not able to like sit down and just do, for example, yoga. Like a lot of times I'll hear people say like, oh, yoga is so boring, because they have that inability to sit still and engage. Meditation, it's really hard. It's a challenge. Meditating is very difficult if you have ADHD, but meditation does alter your brain, and it does help you focus, does help foster and change your neurochemistry so that you can get better. Often on the go, all the time. I don't sit still. So I'm like type A and my boyfriend is like type F. My boyfriend could literally on his days off from work, just like, he's so easygoing and laid back, and he could literally just watch TV all day, like Netflix, whatever. Like, I'm always working on a million things and I don't know how to relax sometimes. So it's a good balance. The person feels like you're driven by a motor, is unable to be or uncomfortable being still for extended time, as in restaurants, meetings, may be experienced by others as being restless or difficult to keep up with. Like, meetings kill me. I'm always like, okay, let's get to it and then let's leave. Like, meetings, just too much talking, not enough doing. And so again, ADHD plays a part. Often talks excessively. In my YouTube videos, I don't really talk a lot in life, but that could be a characteristic of having ADHD. Often blurts out answers before a question has been completed, completes people's sentences, cannot wait for a turn in conversation. I really try to let people finish because it's rude to interrupt. I did have an embarrassing moment when I was like 8 years old once, and there was a competition in regards to how many jelly beans were in a jar. So we had all guessed. So the teacher was like counting. I don't know, let's say I guessed like 301 jelly beans. So when she got to 301, that was the number I had guessed. I immediately stood up and was like, yes, I won. And then she was like, 302, 303. And I just sat down and I felt so embarrassed. So again, that impulsivity of like standing up, not thinking things through. Maybe I'll do a video on the bright side of ADHD. ADHD can also have poor side effects. It can make you impulsive. So you may act out without thinking, and that's where that meditation comes in. Like, instead of always reacting, you want to pause before you react, because I can sometimes be impulsive with my ADHD. Difficulty waiting turn. So difficulty waiting in line. It's hard. Again, you feel like you're wound up like the Energizer Bunny, and you just want to go and go and go and go. Interrupts or intrudes on others. They may butt into conversations, games, or activities. They may start using other people's things without asking or receiving permission. For adolescents and adults, may intrude into or take over what others are doing. And according to the DSM-V, several inattentive or hyperactive impulsive symptoms were present prior to age 12 years. But again, if you feel like you're struggling in school, there's nothing to be embarrassed about. Ask for help. If you want a copy of this for whatever reason, you can email nursingwithprofessor.b@gmail.com. In order for a psychiatrist to deem that it is necessary to medicate you, you also have to have several inattentive or hyperactive impulsive symptoms, like I said before, present in 2 or more settings, and that there's clear evidence that it interferes with or reduces the quality of your social, academic, or that interferes with your occupational functioning. So thanks for watching. Best of luck to you, and until next time.